There are a few parts of our everyday lives that haven't been impacted or changed by COVID-19 this year, but healthcare workers worldwide have been on the front lines of this pandemic. We sat down with health officials and doctors from Unity Point Health St. Luke's and Mercy One Siouxland Medical Center for exclusive and extensive interviews about the virus here in Siouxland.
From the local surge in positive cases in the spring to staff and patient care, the community's part in the hospitals, and the future of healthcare post-pandemic. All this week, we're bringing you a closer look. Now, in part one of our 6-part series this week, we begin with the virus that started it all.
Some people are still thinking that this is a hoax. Please don't underestimate this virus, as it has caused a lot of damage.
Doctors in Sioux City started preparing for COVID-19 before the virus reached the area.
You could just see it moving across Interstate 80 and knew that it was happening. And the weekend that it happened, when I came in on that Saturday morning, it was just that moment of anxiety where it was here. Our numbers just shot up. We knew it was time. And then everybody just kind of hunkered down.
The first positive case was confirmed in early March. Unity Point Health St. Luke's and Mercy One Siouxland Medical Center saw their first inpatient cases shortly after.
Most of the COVID patients that get admitted to the COVID units have a lot of injury to the lungs.
COVID-19 is a respiratory virus. Most infections are considered mild, but others are much worse.
They get a lot of inflammation and lung damage, so they require oxygen. So that's the most common finding we are seeing in the COVID unit is patients requiring a lot of oxygen. Some just get away with using just nasal oxygen. Some of them require the use of invasive mechanical ventilator, which is a breathing machine that helps breathe for them.
Local doctors say they've seen patients with COVID-19 put off their care, trying to ride it out at home.
We have people who are contracting the virus, they're getting sick at home, and they are staying home. So one of the things we are requesting people is, if they get sick, they get short of breath, and they have really trouble breathing, they should come to the hospital sooner rather than later, because the people whom we are seeing now who are not able to make it are the people who are staying longer at home and trying to fight it by themselves.
With a new virus like COVID-19, treatments are always changing.
We have definitely evolved a lot over the last 6 months. And initially, we were trying out whatever was out there. We got information from China. We got information from what they were doing in New York and other places of our country. And as things evolved, as we found that certain therapies were more effective, we have changed our protocol accordingly.
It affected hospitals too, adding barriers between healthcare workers and their patients that weren't there before.
So in the hospital, the life has been a little bit different. So all the protective measures, all the barriers are there so that we keep everybody safe. The treatments have remained the same.
Treating those hit hardest by the virus has also taken a toll on the frontline workers.
But with COVID-19, our whole perception was ruffled to the point where we saw so many people not make it through it that we were disappointed, we were frustrated, depressed. And that has been definitely a very mental strain for all of us too.
Doctors here say there are a few simple things we can all do to help combat this virus.
I would tell everyone to just be very careful. Let's not take this as an easy virus. It can be a passing infection in many, but it can be fatal in many, and it's very hard to predict who's going to get what. So it's better to just be careful, wear face masks when you can. When you're in public, maintain safe distance, social distancing, and hand wash.
This was just part one of a 6-part week-long series, digging deeper into patient care, the medical staff on the front lines of COVID-19, and the future of healthcare. Tune in tomorrow for part 2, where doctors look back at the local COVID-19 surge and how it impacted medical care and hospital staffing. Woodbury County and the surrounding areas saw one of the first hotspots in COVID-19 cases in the tri-state area between April and June, and healthcare workers were faced with many unknowns.
In part 2 of our 6-part series, we look at how the surge impacted our local hospitals and changed how Unity Point Health and Mercy One staff their facilities.
We had 10 days between when we had 10 patients and when we had 45 patients.
Hospitalizations in Woodbury County rose rapidly in late April to early May. Mercy One Siouxland and Unity Point Health St. Luke's halted elective surgeries and transformed areas into specialized COVID-19 care centers.
Within the hospital, we diverted all our resources towards managing COVID-19, towards early detection, isolation of these patients, getting them to appropriate units and then treating them.
Inpatients surged beyond initial staffing capacity.
And during the surge, places from different units would go help, say the ICU, which normally in this hospital, pre-COVID, saw about an average of 12 patients a day. And we were up to in the 20s during the COVID surge. And so there just aren't enough ICU staff to manage all those patients. And so we had nurses and techs and people from other areas going to help in those areas that have increased capacity.
Staff from across the state stepped up to help.
We had staff from Waterloo and Cedar Rapids and Des Moines come and help. We actually had ventilators from our sister hospitals in those cities also. They shipped to us to help with our surge.
The hospital closed to visitors and COVID units closed to everyone but the critical care team.
During the surge, for those key areas like the ICU and for a med surge area as well, we closed them and what we call dedicated the unit to COVID patients. It was really to protect staff and to conserve personal protective equipment.
For Dr. Behera, the surge was like nothing he had ever experienced.
It was like different world altogether. Those were restricted areas, felt almost like a war zone with everybody wearing the PPEs like they're aliens and almost like out of a movie.
Physically, the staff was exhausted. I think administratively, people were mentally exhausted. So you felt physically tired because there was so much that you had to do and so much that was going on.
Week after week, hospitalizations decreased into late summer, but once again, cases are starting to climb in September.
We got as low as 2 patients in St. Luke's in terms of inpatients with COVID. That was mid-August. Now we've crept back up. We're in that 10 to 12 to 15. We just kind of ebb and flow in there.
Healthcare professionals are using what they learned in the spring to prepare for the fall.
We have put together a plan where we have extra staffing in place if we have to call them in. Our COVID-19 units that we had in place earlier that have been dismantled because our numbers have gone down are ready to be up and running any moment. Most importantly, we have reserves of PPEs that we need because I think those are very important in an uptick of these numbers. So I think we are well prepared for the winter.
This fall, the World Health Organization says a surge of cases is expected worldwide, and hospitals in Siouxland are preparing in hopes to weather the storm for a second time.
And we've been trying to get back to normal and at the same time trying to prepare for a second wave of patients. We're starting to see numbers pick up now, and so the things that we're doing to prepare, we're trying to get those things in place as fast as possible.
If you missed any of our stories this week, you can find them at the top of our website, SiouxlandNews.com, and tune in tomorrow for part 3, where we explore how patient care has changed in the age of COVID-19. One piece on the forefront of COVID-19 has been finding treatments that are effective against an unknown virus. As protocols changed and new treatment options were discovered, patient care was constantly evolving.
In part 3 of our 6-part series, we dig into how patient care changed for both COVID-positive and COVID-negative patients at Sioux City's 2 hospitals.
Patients are always number one when they come through our doors. It's always number one.
Patient care has evolved over the last several months as hospitals adjust to COVID-19 protocols, including the way doctors and patients interact.
One of the major, I would even call it a weird thing that I noticed is now we don't shake hands with patients, and we used to always go in, introduce ourselves, shake hands, and that human connection was always a very important factor. I think when we treat people, we just don't treat a number, right? So when that happens, I think a little bit of the dynamics change. I think it's going to be a new era until we get the vaccine, until we get this whole thing taken care of.
And when treating someone who is COVID positive, Behera says it feels otherworldly.
Obviously, in the COVID ward, another factor that plays into that comes into play is our whole PPE equipment, because we're covered almost like we're going to the moon or somewhere, and so that makes us even more alien We try not to make the patients feel that we're aliens.
Hospitals are quieter, too.
I think the biggest change that the public would notice right now is just the lack of the public being in the hospital, which is a bit of a double-edged sword.
It's been hard for families and patients not having visitors with them.
We use a lot of empathy and compassion and try to reassure them that it's for their own safety and for their family members' safety too.
They've turned to video conferencing when having family present isn't possible.
We try to give as many calls as possible to family members to keep them abreast of what's going on.
Unity Point Health tests everyone who is admitted for COVID-19 to keep those infected separate from those who are not. And for those who are COVID positive, it can be a scary time.
When we go into the COVID units, we do take care of them. Obviously, as any other patient, we do our best to give them the best possible care.
At the start, doctors didn't have the answers that patients were looking for.
Sometimes they have questions, especially early on when they had questions for us as to what do you think will happen with me and what's my prognosis. We didn't have that answer, and that was awkward. That was also truthful, but it was awkward because, we don't know what's going to happen because we didn't know how the patient's going to go from there.
For those patients who are not COVID positive, they are asked to wear a mask when interacting with hospital staff. But the hospitals say their patient volume has been down as people put off care.
I think for the most part, patients are still leery, understandably. They haven't wanted to come back into a healthcare facility if absolutely necessary.
They are working around the clock to keep everyone safe.
I would say to patients out there, it is a completely safe environment. We have gone to great lengths that if there is a COVID patient in the hospital, they are isolated appropriately and people are doing the right things in terms of cleaning and sanitation, that nobody should be scared about coming into the hospital thinking they're going to contract COVID because they're here. We go to great lengths to protect our patients and our staff.
At the end of the day, our local frontline heroes are ready for any challenge they face, with patient care a top priority.
I would tell them we're calm, we're ready, we're providing safe care for them, we're providing it their way, whether they're at the hospital or at our clinics. We tell them, please wear a mask while you're here and trust us. We know what we're doing, we've got this.
If you missed any of our stories this week, you can find them at the top of our website, SiouxlandNews.com. And tune in tomorrow for part 4, where we take a deeper look at how COVID-19 has affected local healthcare workers, with Mercy One and Unity Point Health stepping up to take care of those on the front lines. They've been the true heroes of this pandemic, working directly with those hit hardest by COVID-19. Healthcare workers are on the front lines in the fight against this virus, but while they are treating patients, who is looking out for them?
In part 4 of our 6-part series, we look at the risks medical staff working with COVID-positive patients take physically, mentally, and emotionally, and how Unity Point Health and Mercy One are stepping up to help those who spend their lives helping others.
Working, 12-hour shifts in full PPE, gowns, masks, gloves, face shields, that is taxing work. What they do anyway is can be extremely difficult, challenging work, and then you put people in full PPE, it makes it even more difficult.
As all eyes turn to the fight against COVID-19, healthcare workers were the front line of defense.
When you have a patient in the ICU, very sick, and the treatments are not working and the disease is continuing and causing damage to the body, and things don't continue to work, it puts a lot of stress on the caretakers of the patient who are actively involved in their care.
Unlike better-known diseases, care of COVID-19 patients was unknown to start.
We as healthcare workers, physicians, nurses, anybody are trained to treat people. We like to see people get better and go home. We know that when we treat patients for pneumonia or CHF, COPD or other conditions, we know we give them these medications and they will get better. At least 99% of patients do get better. There will be some who will not make it through it, but most of them should.
The danger wasn't only for the frontline workers, but for their families.
And at the time when we were going through it, they have families they go home to. Are they bringing anything home? There was a lot of psychological stress for them in terms of they wanted to be here working, serving their patients, but yet they have lives, they have families, and how do you balance that do what's right for the patient, keep our staff members safe, but yet have them be able to go home and try to live a normal life. It was a very delicate balance.
It is stressful, and it's not just stressful because we're taking care of COVID patients, it's also because our co-workers could be exposed. We also always have the fear of taking this deadly virus back home to our near and dear ones, and we try not to do that by maintaining utmost cleanliness as possible when we use PPEs.
Staff working in the COVID wards stayed there all day to preserve PPE.
Working in those closed units was a challenge because the staff felt isolated. They knew why we did it. I felt like we did a pretty good job with communication. They understood why we did it to protect them. But still, they felt they weren't seeing us. They weren't necessarily seeing the providers. So they did feel isolated.
Even outside of COVID wards, there is little relief.
I think the hardest moments were that we didn't have so much face-to-face. Staff wasn't in the hallways. The cafeteria was closed. Our meetings were all virtual. So that connection that you get with somebody else, with your team members, when you really operate as one team like we do, I think that was the hardest thing. We were all a little bit isolated from each other.
As cases are on the rise again, Unity Point Health St. Luke's is worried that another surge is looming.
It's a little scary when you have gone through what they did and we've come down from that, but then all of a sudden you start to creep up with the numbers of patients. I would suspect there's several staff members that it worries them. Are we going to get back to that same situation?
If you missed any of our stories this week, you can find them at the top of our website, SiouxlandNews.com. And tune in for Part 5 tomorrow, where it's all about the Siouxland community and how they've stepped up to help our local frontline heroes. Hospitals are places where the community goes to seek help, but during COVID-19, Siouxlanders stepped up and gave back to those working tirelessly on the front lines, and their generosity didn't go unnoticed.
In Part 5 of our 6-part series, Unity Point Health St. Luke's highlights some of their favorite moments of community support and how those acts of kindness help the frontline workers get through their toughest days.
The community has helped in ways that we never imagined.
Hospitals serve their communities each and every day, but when COVID-19 hit, it was the community's turn to step up.
We had people that were coming in and say, I have some masks, and they would bring in 5 masks or a dozen masks. So all the homemade masks that were made and created. So it was really a community effort rallying around the hospitals to support us in our time of need.
In March and April, a shortage of personal protective equipment was putting hospital workers at risk, and Siouxlanders geared up, utilizing their quarantine to make cloth masks.
The community was, it overwhelmed us what they did with the handmade face masks. We received almost 10,000 masks from the entire community, and it was a network that we didn't know was out there.
The St. Luke's Foundation turned their focus on finding the PPE that was in short supply.
One of the things that we did in the foundation is reach out to so many people in the community just to say, do you have masks? Do you have face shields? Do you have gloves? Do you have goggles? And we were amazed, over $400,000 worth of personal protection equipment was just out there.
It wasn't just PPE, but food too. Unity Point was able to feed their healthcare team 2 meals a day for 2 months, thanks to community donations. Unger recalls one gentleman who came with his son to donate cookies, and she was met with another surprise.
When I got there, he had purchased these cookies. He had bought some face cream, because if you recall the stories of how your face broke down from wearing a mask, and face cream, and tied them onto every box of individual cookies. And then he said, when I asked him, what prompted you to do this? He said, I got my $1,200 check and I don't really need it, so I spent it buying things to help the frontline workers at St. Luke's. That was phenomenal to me, that somebody thought to do that, and just unexpected.
While Siouxland's surge has subsided, the fight against COVID-19 is far from over, and hospitals still need your help.
We continue to need more personal protection equipment, goggles, face masks, gloves, anything that you have in your business that you might be able to donate.
Especially as the holiday season arrives.
If you're looking at doing something to show your gratitude during the holidays or as we lead up to them, think about those frontline healthcare workers. They're working 12 hours, they're in those warm outfits. Sometimes they don't get a break and they need that time to just stop and have a nice warm meal.
Through it all, the team at Unity Point Health are thankful the community continues to help them through this global crisis.
Just gratitude, extreme gratitude to our community. There's so many people at a time of crisis in a pandemic like this. The fact that the community would really, focus on the hospitals and recognize we play a unique role in several aspects of life in our community, but in a health pandemic, we're critical.
Well, I think what the community said to us is what we've been saying to them. You matter to this world. They really supported us by saying you matter and did everything they could to help us.
If you missed any of our stories this week, you can find them at the top of our website, SiouxlandNews.com. And tune in tomorrow for our final piece, where we explore how COVID-19 has changed the face of healthcare. COVID-19 has made permanent changes in how we live our lives, some of which won't be known for months or years to come. But when it comes to healthcare, some of those changes are already coming to light.
In the final part of our 6-part series, Unity Point Health and Mercy One talk about the future of healthcare and what you might see the next time you visit the doctor.
We have permanently taken a little shift on our axis, and we will never be exactly what we were before.
The last 6 months have changed nearly every aspect of healthcare.
It's about communication, what worked well for the staff and the caregivers, and if they said, that didn't really work well, we would prefer this, or we think you should try this going forward. We've listened and made those adjustments. It's very situational. I don't think you can really throw a blanket on it and say this is the only way we're going to do it. Again, we've learned from our initial 4 to 5 week run with this.
Much like our business meetings, even medicine has gone online.
I think the single biggest piece of that is virtual medicine. This was something that was kind of on the cusp of being more of a day-to-day reality, but we have proven through this pandemic that you can receive medical care virtually with telemedicine, e-visits, connect with your provider, and still maintain your health and receive care through your providers.
Inside and out of the hospital, telemedicine has made its place.
I think we'll see a lot more telemedicine as well. It's something that we have inside the hospital we never really had before, so physicians could round on patients inside the hospital using a telemonitor. And then I think in the public too, if you probably yourself have gone out on the internet and maybe done, instead of going into the urgent care.
Visitor access within the hospitals stopped, which Unity Point Health says could lead to permanent changes.
I do believe that the number of folks and the amount of foot traffic that we will allow through our care facilities will be much less in the future.
Right now, elective surgeries and non-emergent visits are starting back up, but even that is slow.
We need to gain confidence, again, that people can come to their healthcare providers, clinics, surgery centers, hospitals, and it's safe. It's a safe environment.
Lessons weren't only learned in clinical care, but also emotional care.
I think the biggest lessons that we've learned are when to follow your heart and when to follow your head. And those are hard when you're on the front line. We heard some pretty difficult stories. It's very hard when you have 2 patients you're taking care of and somebody might not make it and another one will, and learning how to help those team members. I think the other lesson was that the work that we do every day, all year, is what got us through that. To be able to do what we do, and we were there. Everybody was there.
Until a vaccine is available, it is up to everyone to help slow the spread.
It is very unpredictable, so we would not know on how much damage it can cause to patients. So there will be people walking around who would be carrying the virus and who would be sharing it, and they wouldn't know, nobody else would know that they have the virus. The only way to protect the other people from them is if they wear the mask. So
the next 6 months will be critical for all of us in this community. The most important thing that I can ask the community to do is please wear a mask. No matter where you are, wear that mask and social distance. We've shown that it works. We know that that works. So please do that. It's simple. We know it might feel inconvenient, but we can't stress enough how important that is to wear your mask.
To see our extended interviews with these medical professionals, visit this story on SiouxlandNews.com. If you missed any of our stories this week, you can find them at the top of our website, SiouxlandNews.com.